what have I done wrong? I followed the mandate and then followed the medical advice provided to me.
This isn't someone who's gone there and said, I don't want it, didn't put a sign up saying, I don't consent, inject me, and then said, oh look, or gone to his workplace and said, I don't want the shots, I want to keep working. The person went to get the shot. As you said, was compliant. John got vaccinated. He suffered injuries. He's even looked at getting the second, spoken to his doctor, spoken to specialists, and they've said no. So
what more could you ask for John?
Sorry?
What more could anyone ask of John?
I don't know.
And I don't know what they want.
All these lies impact your mental health as you wonder, what have I done wrong? I followed the mandate and then followed the medical advice provided to me and continue to follow continue to have medical tests to establish what happened to me and treatments that are available. But in the meantime, I feel I'm being chased out of employment because of a vaccine injury. This is not a behaviour of a caring health service who would be interested in my medical evidence and my well-being, but a hospital who continues to lie and only cares about enforcing the mandate at all costs to human life.
I am shocked that this matter has gone as far as it has gone for the reasons that you just put out, because that's my sentiment as well. What more can this guy do? This isn't someone who showed any, to use the umbrella phrase, anti-vax sentiment. This is someone who was compliant.
I think he's a little bit too pro-vax. If you just paralyse yourself in dose 1 and you're lining up for dose 2, have a long, hard think about yourself. He's the opposite of anti-vax.
I'd say that's right. I'd say that's right. Look, in terms of his choices, if he wants to go for his second or third, knock himself out, that's his call, but ultimately he's got the evidence that says he shouldn't, and that is strong evidence. That's not just some backyard clinic. He's been told to go to specialists. What more do they want? I don't know. And one then has to go back to, maybe it's just their policy where they've written and gone, we don't care what he says, just enforce it.
Yeah, but they're contradicting themselves because they had someone from internally come out and say to all staff, if you've had one dose but you can't or won't have the second, we'll work with you. But not him. I guess because he's already in the system.
And there's also, I guess, two ways to look at it. That's internal, not external. It hasn't gone. And that's been said to internally been done. There's certain things that are going to be hard to get. They'll come out eventually in hearing. All this stuff's going to be tried and tested. Yeah. And that's where it's important. That's why this matter does need to go to hearing, so both sides can be tested and it can actually be shown John's telling the truth.
Well, that is the role of your profession. Needs to do a good job in holding them to account. And whether you win or lose, testing it in court is important for us to see what was real.
If you're terminated now in 2023, I think the case is a little bit different. The Commission may not yet, and I don't know many people, in fact anyone who's tried it, but if you are terminated in 2023, especially if the policy was not enforced throughout the whole of the dangerous period, and now we're moving away from it where you're basically mingling with unvaxxed people everywhere you go, is it still reasonable to have that policy? My argument would be no, it's not, based on the features of this current time, the way that people have moved and people's sentiment has moved. I guess you could say the market has moved, even not the right term, but the market's changed. So now, is it still reasonable? In my opinion, it's not, but I haven't heard anyone actually try and argue it. So then, if you look at that case law in that time from a year or two ago and look at it now, there's that differentiation. And I think that's a big one.
But logically speaking then, as we move away from the pandemic, the likelihood of such a case getting up against your employer for firing you for not getting vaccinated is more likely to succeed the further we go.
Totally.
As the rest of society is all just mingling and not wearing masks.
Unless there's legislation introduced like they did in Victoria, where they basically have given the ability for employers to choose for a bit, and the pandemic is arguably not over here, although the rest of Australia kind of is. It's a bit, that could change a little bit, but there's still an argument to be made, yes. And how many employers are still enforcing it? There are a few, because I still get comments and messages from people telling me when they apply for a job.
Coles is still doing it.
Coles is still doing it, from what I understand, yeah. But see, before they employ you, it's a little bit different.
Of course, they can choose to not employ. Yeah, that's fine.
You can argue a general protections matter. You could say it and say it's discrimination now, but I don't know if you'd succeed, and is it worth going down that path just to work at Coles? Right? So there's your argument.
That's a great workplace. Okay, so when I asked you about there seems to be a lot failing at the Commission or in court, I'm probably referring to people who bring cases against government mandates. And as you're saying, case law's established now, just don't bother.